Last September, Tennessee's Board of Medical Examiners unanimously adopted a statement that said doctors spreading COVID misinformation, such as suggesting that vaccines contain microchips, could jeopardize their license to practice medicine. "I'm very glad that we're taking this step, Dr. Stephen. If you're spreading this willful misinformation, for me it's going to be really hard to do anything other than put you on probation or take your license for a year. There has to be a message sent for this. It's not okay." The board's statement was posted on a government website. It used language suggested by an umbrella group, the Federation of State Medical Boards. More than a dozen other state boards also posted the language, which warned doctors that spreading inaccurate information about COVID vaccines threatens to further erode public trust in the medical profession and puts all patients at risk. But before any Tennessee physicians could be reprimanded, the growing tension in Tennessee between conservative lawmakers and the state's medical board may be the most prominent example in the country. Now the Federation of State Medical Boards is tracking legislation, introduced by Republicans in at least 14 states, that would restrict a medical board's authority to discipline doctors for their advice on COVID. Dr. Humayun Chowdhury, the Federation's CEO, calls it an unwelcome trend. The nonprofit association, based in Euless, Texas, says the statement is merely a COVID-specific restatement of an existing rule, that doctors who engage in behavior that puts patients at risk could face disciplinary action. Although doctors have leeway to decide which treatments to provide, the medical boards that oversee them have broad authority over licensing and discipline for misconduct. Often, doctors are investigated for violating guidelines on prescribing high-powered drugs. But physicians are sometimes punished for other types of unprofessional conduct. In 2013, Tennessee's board fined U.S. Rep. Scott DesJarlais for having sexual relations with two different female patients more than a decade earlier. Still, stopping doctors from sharing unsound medical advice has proved challenging. Even defining misinformation has been difficult. And during the pandemic, resistance from some state legislatures is complicating the effort. A relatively small number of physicians peddle COVID misinformation, but many of them are associated with the group America's Frontline Doctors. Its founder, Dr. Simone Gold, has claimed patients are dying from COVID treatments, not the virus itself.